Today I will be demonstrating the correct technique of taking a blood glucose level or a BGL for patients with diabetes mellitus. It is important to know how to do these, especially when you're working in a clinical setting, because 4.6% of the Australian population have diabetes and a lot of people in hospital will have diabetes. I'm going to be teaching Bridget how to do this procedure by demonstrating it on myself, so I'll talk her through the processes. As this procedure involves blood, it is important that we follow the universal precautions and wear gloves, but before doing so and before performing hand hygiene, we'll just check that we have all the things set up. So it comes in a diabetic kit with the needles, wool and the machines. So they should all be calibrated before the shifts, like as the shift starts and at the start of the day. But it's the machine, the strip, the needle, an alcohol wipe and a cotton ball. Okay. I'll be the patient today, so it's important that I do the hand hygiene as well as the nurse that my colleague's going to be. So this water's warm, which is good, so that the circulation is still flowing into your hands. Now that she's got the gloves on, she's able to start the procedure. So what you want to do is just turn on the machine, just make sure it's working. And then first of all grab the alcohol wipe just to clean the area. Now you don't want to take blood from the finger, the index finger or the thumb, because those are mostly used. Wipe the whole finger for about 15 seconds and then let it dry for 13 so that the antiseptic actually works. But she should aim to use the outside of the finger because that's where more of the capillaries are. Then just grab the strip and put this black end into the machine, and so that the end with the little hole there will be grabbing the blood. So you just want to grab the little orange needle to grab the blood, and just on the side there. She won't actually prick me, but okay, so she actually pricked me, and as you saw in the video, she applied pressure. That needle should be thrown away immediately into the sharp spot, and then just collect the blood in the strip. Don't actually do it, but and then give a cotton wool ball and tell them to apply pressure, just so that in case they bleed out a little bit. And then once you get the reading on here, it's important to document that. Okay, she's just disposing of the gloves, the strip, and any other things, the alcohol wipe that she used. So once you've recorded it from the machine, just record that reading onto the patient's diabetic chart, and that reading for a normal reading should be between 4 millimoles and 8 millimoles. Anything above 8 millimoles is hypoglycemia, and anything below 4 millimoles is hypoglycemia. It's important to know the difference and know how to treat a patient if they have a high reading or a low reading. Hypoglycemia is too high of a reading, so this will mean that the patient's tired or weak, dizzy, and that means that they've had too much food or they're inactive, and it's normally like an increase in their weight gain, but it's more patient specific, so they need to talk to their GP about monitoring and changing their diet, and then just continue to monitor their readings and if it's too high. But that's more patient specific, and there's not too many interventions that we as nurses can do other than educate them and just let them know that their diet is probably inappropriate for their diabetes. So hypoglycemic, when their blood sugar is too low, so below 4, so that will show if a patient's hungry, sweating, dizzy again, and you can treat that by giving them the jelly beans, the glucose jelly beans. So most wards will come with a hypoglycemic kit with jelly beans, like soft drink, stuff like that. So half a can of soft drink, some jelly beans, like just sugary foods to try and bring the glucose levels up. And then take it again after 15 minutes and re-record that as well. Yeah. So it's important to look for these signs when you're taking the BGLs, not just taking it and forgetting about it. Hopefully this has been informative for you and you've been able to learn how to perform a correct BGL and you know the parameters and what to do if it's low or high. Do you think you'll be able to perform this on the ward and in clinical placements?
Yeah, thank you.
That's all right.